What is mental health counseling? Mental health counseling is distinct assistance provided to individuals struggling to process circumstances through collective perspectives. Distinct in that, compared to a psychologist who tends to work with individuals with serious mental illnesses such as bipolar and schizophrenia, or a psychiatrist who uses medication management as a course of treatment, and then social workers whose sole purpose is to connect clients to resources based on lack, needs that are contributing to the mental breakdown. Clinical mental health counselors, according to Mark Garrick, a licensed mental health counselor and a licensed psychologist, he says that counseling is a distinct profession with national standards for education, training, clinical practice, and for mental health wellness. Clinical mental health operates from a wellness perspective, which emphasizes moving toward optimal human functioning in mind, body, and spirit, and away from distress, dysfunction, and mental illness. Mental health counseling views wellness and pathology as developmental in nature and takes into consideration all levels of a client's environment, whether it be their family system or their social system, when conducting assessment and treatment. According to ACA, a unified definition of professional counseling was comprised by 31 counseling organizations as a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health wellness, education, and career goals. Theodore Rimley says a counselor's professional identity is a nebulous concept, but it is vital to long-term success of a profession. And Broughton Myers argue that professional identity is a process rather than an outcome, and that even seasoned counselors must constantly re-examine their identities to meet new challenges. As professional health mental counselors, although the focus has changed from encouraging students to go into further academic studies in science and math to that of pathology building, we still use counseling intervention techniques developed by Hippocrates in 400 BC. We use systematic diagnostic interviews, detailed history taking, trust building, dream interpretation, and acknowledgement of repressed feelings. Now, as a professional mental health counselor, we must be reliable and capable of delivering effective levels of core skills, aware of our biases, and we must develop cultural sensitivity and possess a sound ethical decision-making model for those times when we're faced with situations which require some ethical decision-making ability. We must have a working knowledge of human growth and development, understanding how people learn and grow. Social and cultural foundations. As counselors, we must possess a theoretical background necessary for functioning effectively with diverse populations. As counselors, we must be innovative, educators, practice mindfulness, be authentic, seek supervision and support as necessary so that we can avoid transference, countertransference, or causing harm to our clients. As counselors, we may need to advocate for our clients by collaborating with other helping professionals or challenging some systemic issues or making aware vital information that a client may not have access to. As counselors, we must understand the accountability that society holds towards us and that we have toward society. We must provide pro bono services as necessary. Because as Dr. Martin Luther King would say, what affects one directly affects all indirectly. And lastly, I would say as counselors, I think we are driven to do the work we do not only because we either feel called to help others or because we too have overcome some traumatic experience or because our Myers-Briggs test results defined us as counselors. I think it's because we're adhering, whether knowingly or unknowingly, to the advice of Mahatma Gandhi when he encourages us all to be the change we wish to see in this world. As counselors, we get to make a difference. Let's make a difference in somebody's life today. Mental health counseling matters.